What's up, guys? Dr. Gabrielle Lyon here, and my charming co-host, Dr. Donald Layman. Don, I don't think you've ever been a co-host of something, have you?
I don't know. I don't remember.
Well, this is really fun. This is a 20-year mentorship relationship that I wanted to share with you because Don and I have many conversations and just wanted to make these available to you. And the big topic today is, what is more effective, diet or exercise? Now I'm going to go first, and I'm going to tell you, I would love to believe that it would be diet. And I think that they say that 80% of your abs or whatever are made in the kitchen. When you think about diet, from my perspective, I think about losing weight. And of course, weight then branches out to fat tissue and maintaining skeletal muscle mass by restricting nutrition and really focusing on nutrition, increasing your protein. You can definitely lose body fat. There's no question that you can lose body fat. Can you maintain skeletal muscle that way? Yes. You can affect metabolic parameters like triglycerides, like blood sugar. Can you gain muscle by just improving your calorie balance? And the answer just through nutrition would be no. You cannot do that without training. So if you are looking for weight loss, overall weight loss, then nutrition is better. If you are looking for changing body composition, and I say that in a way, in terms of muscle mass, then obviously resistance exercise is better. And the other aspect about a resistance exercise is it does have an impact on metabolic markers, like it improves glycemic control. It can decrease inflammatory markers, things of that nature. So I'd love your opinion on this, Don.
Yeah, I agree pretty much with exactly what you said. I would take the two sort of extremes. If your objective is to lose body fat, that's a nutrition issue. That's a calorie issue. It's almost impossible for most people to do enough exercise to lose body fat because part of it is your appetite goes up, so you eat more. So clearly, losing body fat, first and foremost, is a nutrition issue. Right. If you're trying to gain muscle mass, it's a resistance exercise issue, just exactly as you said. The way I kind of think about the balance of those two, though, is that they work together on almost all areas. And so if you choose the extreme, that if you choose to be totally sedentary, then the precision of your nutrition has to be absolutely perfect.
Right.
And if you choose to be physically active, then you have a lot more flexibility in your nutrition choices. Mm-hmm. So I kind of think of them as interacting with each other. And as you make lifestyle choices on one or the other, you have to use the other one to buffer it. If you choose to have a lousy diet, right, then you better exercise the heck out of yourself. Right. And I think they balance that way. And then you can get into individual things like, well, I'm interested in blood sugar or triglycerides or whatever, and then you can get into some different answers.
Yeah, I agree with you. And I just think it's interesting because I get that question a lot. What's more important, diet or exercise? And it really just depends on what you're looking for. Both are important. Body composition, muscle mass, aging, I really think about resistance exercise, although I can't say that they're, they're mutually exclusive, right? They're not. You assume you're doing both, but resistance training is absolutely essential for longevity and for a lot of other reasons that we're starting to find out, like this release of myokines and the effect on the immune regulation and the effect on inflammation and the effect on the brain and the bone and all these, and even when it comes to partitioning nutrients, which we can talk about at a later date. Yeah, so if you were to pick one, let me ask you this, for you personally, if you were to pick one, what would it be? What would you focus on?
Between nutrition and exercise?
Yeah. Yeah.
Wow, that's so foreign to me that I can't.
I know, but this is all hypothetical. It's all hypothetical.
I think that I think there are reasons that people can't exercise at the level you and I do, and so I would say that nutrition has to be the most important. I think if you're truly optimizing things, you and I would jump to exercise. Right. but a lot of people can't do it, age or disabilities or whatever. I think, in your practice, in my, research work, I think we know that there are individuals who have different choices about, what they're willing to do.
Right.
And ultimately, you have to work within somebody's phenotype, somebody's choices. And you can say you should do resistance exercise 3 times a week, but if they won't do it, then you have to make other choices.
Right.
So, I think there's the theoretical what's optimum, and then there's the practical what's this person going to do.
Yeah. So there you guys have it. And Don is absolutely right. I would pick exercise. I mean, obviously we don't have to pick, but I would definitely pick exercise, because if you are training really hard and you're really thinking about muscle mass, which obviously I am, then that's the way to do it. Yeah.
The one other example I would give to this argument, though, would be something like metabolic syndrome, glycemic regulation. And so we know from studying people who are pre-diabetic, who have abnormal triglycerides, abnormal glucose, that you can basically correct those within a week with a diet change. But to do it with exercise usually requires changing body composition. It takes longer.
That's a really good point. So that is also a great point.
So here's a clinical situation where I think diet actually has a quicker impact than exercise probably would. At least within normal levels of exercise people can do.
Okay, so that's really interesting, and a very good point. I would love to hear you guys, which you prefer, which is also easier for you. Is it diet or exercise? And I do want to say that if you choose exercise, you have to be really training. And I think that there's a component to training in a way that is effective and meaningful to the body, because there's something to be said for just activity versus actually really training. And that will be a topic for another video. If you guys like this video, please like it, subscribe to the channel. And as always, we really appreciate your views. We do this as a labor of love, just to share good information. And it means a lot to us that you take the time to watch. So thank you.